So I want to build a little bit on the comments that you've heard from the previous three speakers, because I think it's extremely important to look at the issue of innovation. As I mentioned in my previous remarks, if we keep doing the same old things in the same way, we're going to get the same results and scratch our heads and wonder why. So I'm going to outline for you a couple of things that, one program in particular in New Brunswick, and then a couple of other initiatives by the Commission that I think are well worth hearing about. So a theme that I've been hearing today and most recently with the panel is the whole idea of collaboration and partnerships. But the word silos hasn't been mentioned. My experience in my career is that, when I've worked hard to break down silos, I've been really proud of myself and really excited. And then when I turn my head, I look and there's three more popped up over there. So I don't know what it is, but it seems to be part of our human nature to want to work in silos. One program that has actually done that, and I think have done it very well, which is innovative. It shouldn't be. We should be doing it everywhere, but is in New Brunswick with Child and Youth Services. And they have they're not only just working together, they have taken the budgets and combined them. Now that takes real guts, because, when I talked about At Home Chez Soi, the savings that we realized there was a result of pooling resources. But if I have my budget, it's going to be really hard to say, well, actually, I'm going to take my budget and put it with yours. But I have to tell you, I think it's needed. In New Brunswick, they have combined education, they have combined health services, community services, and I believe there's one other. And they have not only just said, thou shalt work together, and thou shalt have all the same budget. And so it's something that I'd recommend taking a look at, because I think that can and should be done in other parts of mental health care. The other thing is I think part of my job is collecting really good secrets in Canada, because as I go across the country, I find really good secrets. Affirmative Ventures being one of them, Stella Burry in St. John's, the combined program in New Brunswick, and others even up north. And so I think the concept of knowledge exchange and translation is really critical. What we have done at the Commission with our Knowledge Exchange Centre, which has now been replicated in 3 other countries, is looking at the whole notion that we have new programs and research, and it takes on average 15 to 17 years for the information from those to actually reach a clinician's office. And so we have looked at a way of trying to break that down and to shorten it. And so we actually have a program in British Columbia that's looking at replicating our KEC provincially. And so I thought, wow, what an innovative idea that is. They're doing it in 3 other countries, but they're not doing it in Canada. So that's another area, and I'd be happy to elaborate on that further. Another area of really strong innovation is that if we will never, a country the size of Canada, ever have enough mental health services on every corner to meet the needs. Never. So what are ways of overcoming that? And I really think it's e-mental health. We have learned from our colleagues in New Zealand, who are the world's best at doing this, that things for mild and moderate illnesses can be done not only as well, but even better online or by phone than face-to-face. So cognitive behavior therapy is very much amenable to e-mental health, and it's something that allows people to access services in their own time, in their own home, and with people that they can really relate to. Youth in particular are not going to go sit in a waiting room like I've done. They want to pick up their phone and be able to do something there and then. So there's really great ways of dealing with mental health. And the last concept I'll talk about is when we talk about a job, we have to think beyond the confines of an office or a building. And I think about first responders in that regard. And it's important to remember that there are other ways of providing help and support than in the confines of an office. The Road to Mental Readiness is a program that we have now trained 60,000 first responders in Canada in a very short time frame. I actually had one police officer who said to me, he said, I took the program, I went home and I said to my wife, just look at this. It's a color-coded, so it's not pathologizing anything. He said, I was up nearing the red. And he said, look, I have all of these signs and symptoms. So he went and got help. He said, I'm pretty sure it saved my life, but I can guarantee you that it saved my marriage. And so it's something, again, I don't have time to get into it right now, but it's online at the Commission. And then the other program I briefly wanted to mention, which I'm sure some of you are familiar with here, is Mental Health First Aid. With R2MR, it helps you do a self-assessment of mental health first aid, helps you to identify problems in other people and what to do about it. Strongest Families with regard to mental health is that's now being replicated in New Zealand. It's it's here in Halifax and in several other provinces, not all of them, but if I can do anything about it, it will be offered in every province and territory. It's a wonderful program and it's something that you can and should be very proud of. So I just wanted to briefly mention those things and really push the whole idea to think differently and to think creatively, because we have to do things differently going forward. Thank you so much.